Welcome back from the break, and thank you for joining us again through the afternoon here. Patients from underserved communities often encounter distinct barriers through the cancer care continuum. These are shaped by inequities related to access, trust, language, culturally appropriate care, stigma, social support. For individuals from historically marginalized communities, barriers to care often emerge at multiple stages. Symptom recognition, diagnosis, treatment navigation, and survivorship support. This session will explore the lived experiences of individuals from underserved populations and highlight opportunities to build more equitable, inclusive, and culturally safe oncology systems. By elevating patient perspectives, this session aims to inform more responsive care delivery and catalyze meaningful system-level change. We welcome Dr. Nahid Dasani, who is a physician, health justice activist, and health equity expert, and he will moderate our patient panel discussion designed to explore the cancer experience through the lens of individuals from marginalized populations. We have the great privilege of being joined by 5 young individuals who have experienced cancer and are very vulnerably going to share their lived experiences and their perspectives with us today. A very warm welcome to Harjeet Kaur, a stage 4 rare blood cancer survivor, J. Nadia Headley, a stage 3 breast cancer survivor, Kaylee Engel, a stage 4 melanoma patient, Peter Linnaeus, a 2-time testicular cancer survivor, and Leanne Mantla-Look, an RN and gastric cancer patient. Warm welcome to everyone. Thank you so much for being with us today, and I'll pass it over to you, Dr. Dasani, to kick things off.
Thanks so much, Cassandra. Thank you to everyone for joining us today. Before we begin this conversation, I do want to take a moment to center why we are here and what we are being called to hold together. When we talk about cancer care in Canada, it can be easy to default to the system we imagine we have, one that is universal, compassionate, timely, and equitable. But the reality is much more complicated. For many people, especially those from historically marginalized or underserved communities, the cancer journey looks and just feels very different. Across the country, we see clear patterns, delays in diagnosis because symptoms are dismissed or misunderstood, challenges navigating complex systems without culturally safer support, experiences of stigma that lead people to avoid care or wait until they are critically unwell, gaps in access to age-appropriate services, supportive care, and survivorship resources, and a persistent disconnect between the diversity of people who experience cancer and the data we rely on to make decisions about programs and funding. These gaps are not the results of individual choices, they're the results of systems that were not built with everyone in mind, systems that continue to underserve Black, Indigenous, racialized, LGBTQ2S+, newcomer, rural, housing insecure, and low-income communities, for example. Systems that do not consistently collect or use demographic and social data in ways that help us understand people's lived realities. And so today's session is not just a panel discussion. It's an opportunity to learn directly from people who have moved through cancer care while navigating the weight of structural inequities. They are pretty amazing people. It's a chance to reflect on what it means to provide care that is culturally responsive, trauma-informed, and rooted in dignity. As a clinician, I know how powerful it is when a person's story helps illuminate blind spots in our system. These stories, they are data. They help us see where care is falling short, where trust has been broken, and where meaningful change is possible. We also need to better understand demographic data collection in oncology. Without high quality data that reflects the true diversity of people who experience cancer, we cannot design equitable care systems. Collecting that data in a way that is respectful, safe, and transparent is part of a socially just cancer system. As we listen, I invite all of us to think not only about what happened to each panelist, but what their experiences tell us about the system. Where does it need to grow? What needs to shift? What would it look like to design cancer care that truly leaves no one behind? And so formally, our objectives for today's session are to address the importance of culturally responsive and inclusionary care models and the role of stigma in care avoidance or delays, to also look at structural and informational barriers limiting access to timely diagnosis, supportive services, and treatment navigation. And finally, the need to diversify cancer data collection to better reflect the experiences of marginalized and underrepresented communities. With that, I want to once again thank our panelists for their courage and their willingness to teach us. Your voices are essential in shaping the future of cancer care in this country. So without further ado, let's begin. One of the first questions I was really curious about, because it's come up, is, throughout your cancer experience, we're just going to go quickly through the panel, and then we'll get to know you all a little bit better. Was your demographic data actually collected? If so, how was it collected and what information was captured? We'll start with Harjeet. Any thoughts?
Oh, yeah. So for me, I think my demographic data was collected, but I think they just noted the generic things, my age, my gender, and whether I had my family here. But actually, no one asked about the deeper layers that shaped my experience, being a South Asian, an immigrant woman, navigating a rare cancer all by myself in this new country. Also, whether cultural beliefs or language barriers affected my care or not. No one asked me about cultural needs, mental health, trauma, or the silence around cancer within my community. And I feel because my cancer is so rare, only 150 cases have been reported globally. So none of my lived experience was captured in a meaningful way. There's no research in Canada and not a single documented Canadian case until now with my type of cancer. And I feel when your identity isn't captured in the data, your challenges disappear from the system. And what isn't measured is ignored today.
Thanks, Harjeet. Such a great response. Really appreciate it. I will kick it to Nadia next.
Thank you, Dr. Nahid. Um, Throughout my journey in terms of diagnostics, etc., I don't remember any of my race-based data being collected. They did, of course, ask about my age and, like Harjeet said, my gender. However, after treatment, I was fortunate enough to participate in a research study by Mount Sinai Hospital and Sinai Health, led by Dr. Andrea Cavalli, and they were looking very specifically at the experience of Black women across Canada in cancer care. I was invited back to participate in the consultation that reviewed some of the recommendations that came out of that study, and offer the opportunity to share my story along with other Black women from across Canada who had experienced cancer care. So it was late for me in terms of my actual diagnostic process, but grateful to have been a part of it to sow the seeds for the future.
Thanks so much, Nadia. And how about you, Kaylee? Any demographic data collection or any data collection?
Yeah, for me, it was collected sometimes, but it was always like a standard intake form, things like age, gender, and sometimes ethnicity and sexual orientation. But I didn't find that anything ever went in depth. And
Yeah,
it was always just checking it off on the form, and that's where it ended.
gotcha. Thanks so much, Kaylee. How about you, Peter? What were your experiences like?
Thank you so much, Dr. Jasani. So, in my case, because I ended up having my initial intake for my first diagnosis with testicular cancer echoes some of the other folks in the room, very standardized, not really a lot, but in all full transparency, it all happened so fast that I didn't really have a lot of time to consider. And also, before that initial diagnosis, the term cancer was never really on my radar outside of, frankly, what I'd seen in media. So it wasn't even registering to think of those things in the moment. When I had my second diagnosis, because it was bilateral with a 3-year gap in between, apparently I reached some level of unicorn status where it's a 3% chance that happening. So they let me know, would you be interested in being part of a case study? We're going to track how things go for you because the development for chemotherapy treatment for testicular cancer was in the late 90s. I first got diagnosed and treated in 2002. They let me know that I'm kind of at the front end of the curve. So that data is being tracked in that respect and letting me know about it. And then with long-term scans for CT scans, they asked if I wanted to be part of a study where was the effectiveness of low dose as effective as standard dose because I was still going in for my regular checkups. Outside of that, when it comes to data collection, I wasn't aware of what to ask. So I just sort of took it as status quo that that was the standard of care at that time. But it felt generic.
Thanks, Peter. And last but not least, Leanne, what was your experience like?
Hi, thank you. So in the Northwest Territories, we have, I think we have cancer data, but in order to prepare for a conversation similar to this at a different conference, I looked at the stats for the Northwest Territories. And for the year that I was diagnosed, all that it said on there was 2015 and the number of people who were diagnosed with gastric cancer. That was it. I was one of those people.
Wow.
So
So
they didn't get my my indigeneity. They didn't get my gender, where in the Northwest Territories I was from, just stomach cancer 2015.
Wow. Thanks to you all for sharing that. And I know that was a quick around the horn kind of discussion, but really hearing some resonating themes, the idea that a lot of things were not being asked about, things that really described your experiences. And if you were asked things, it kind of felt like a one size fits all. So just a really interesting point to start our discussion around. Now we get to like my favorite part, what I think my favorite part of this discussion will be is getting to know each of you and your very inspiring stories. I wanted to start with Peter, if that's okay. We would be really grateful to hear a little bit more about your experience with cancer at a young age and as a member of the LGBTQ2S plus community. Could you tell us a little bit about what that journey was like?
Sure. As captured a little bit earlier, my first diagnosis was back in December of 2002. So I have no illusion about the privilege that I can sit in front of everyone as a 20 plus year cancer survivor with multiple diagnoses. And the scope and spectrum of walking in, there were a number of different moving parts. As someone who identifies as a cisgender male, as well as being part of the LGBTQ community, I looked at from a men's health perspective of, well, I'm a stereotype guy. Therefore, if everything is, I break my leg, so I'm just going to go walk it off. No, you need to go to the doctor. You need to see things. You need to get questions answered, listen to your body, and understand what's happening in the moment real time. My journey ended up starting with a chronic pain in my left testicle. And over the span of 5 weeks, regrettably, I was being misdiagnosed, but it was about having the right person in front of me at the right time. And I was just going to Toronto Emerge. Now, it wasn't even on my radar to talk about my orientation because of the nature of where because it was testicular cancer, I was more wrapped up in my gender identity and what it was going to mean to get an answer on what was actually happening. So from being told things like mesenteric adenitis, possibly a torsion, an STD, and I joked about it thinking, don't I have to be having sex for that to happen? And being sent home with antibiotics and painkillers for 4 weeks straight with this wait and see, not knowing what's going to happen. And then I lucked out on week 5 and Emerge, happened to be a urologist. He took one look, ultrasound CT, let's go. And within 36 hours, I was on the operating table having to call one of my employers with my most comedic job quit ever because I couldn't stand that job. And it was only 2 weeks in, but I knew it was not going to work. And apparently neither was I. So I ended up going through the process, and within a short period, I get put on my chemotherapy schedule for 6 rounds. I ended up doing a follow-up surgery where we thought that I was in the clear, but I had all these dark spots in my abdomen. And all the while I'm going through this, I'm trying to reconcile my identity both as a man, as a gay man, and how do I interact with the rest of the world, trying to explain that I've lost one testicle. What does that mean about me as a person? Because it's this invisible change in my identity, but psychologically and emotionally, it's impacted me with a lot of the intensity that's wrapped around male gender when it comes to genitals and how it is it reflects on us as people. So that ends up going where I have an RPLND surgery in my abdomen. I found out later the third most invasive surgery you can do in a person. I go in with a 50-50 chance of waking up because of the bleomycin affecting my lungs, and I'm 26 and I've got to wrap my brain around all of that. I get through that surgery, and then 3 years later, I feel a familiar twinge in the other testicle, thinking to myself, no, that can't be right. But herein lied the self-advocacy. Marched right back to the same hospital, said, hey, I know I'm supposed to have graduated, but maybe I need to come back for a makeup course. I need you to check this out. And they're like, like the odds of that being the thing is next to impossible. 36 hours later, and me refusing not to leave, I find out I've got stage 1 testicular cancer in the other testicle. And they were just shaking their heads going, how did you know? I said, because I know what it feels like and I'm not going to gamble. Now, that married with my LGBT identity and trying to explain myself. And I mean, granted, I do stand-up comedy, so building into, my dating life and experience and identity and how to present myself and what are the challenges, as much as I made it jovial, it was really hard trying to reconcile who am I now based on North American gender stereotypes and the way that I was raised to present myself as a man. Am I still that person anymore? And thanks to a really great amount of psychosocial oncology and therapy, I came to remember, wait a sec, that's maybe like 2%, well, in my case before 3% of my body, and it's okay. That's not what defines me.
We are really grateful for you to be so vulnerable with us, and absolutely love how you inject humor into your really difficult experience. It's really beautiful, Peter. I'm just so curious a little bit about more specific aspects of your journey. So for example, did you feel isolated during your cancer journey? Did you find that you were able to access age appropriate and inclusionary care? And sorry, last piece, how do you believe that your experience might have differed if you weren't accessing care, for example, in an urban area?
The sense of isolation was incredibly prevalent. At that point in time, I had to do my own research in order to try to find anything that was remotely aligned with testicular cancer survivorship, finding some level of, other fellows who had been through the same thing, someone to talk to. When I was going through treatment at Princess Margaret, because I was a young adult, the majority of the folks in the daycare were somewhere around 60 and over. So I had nurses that were the same age as me, effectively, and trying to not think of how, all right, well, my mortality's been challenged. What kind of a wrench has been thrown into my life? And am I going to see the other side of this? I don't know. When I think of it from the LGBT perspective, that was even more isolating because now how and where do I identify with people, either amongst my care team, let alone finding other people in the room where I can sit down and have that, oh, you get it, and I can talk to you and it's okay. Uh, I was very fortunate to have one nurse make a referral to Young Adult Cancer Canada, and that was honestly just a godsend for the longest time, going to retreats and going to conferences, meeting my tribe, as it were, and being able to connect on that level to help eliminate those feelings of isolation. If I think about now, I was in downtown Toronto, so it was very accessible for me to get treatment. I don't know how much of a difference it would have made for something more rural. I mean, I come from Pickering, Ajax, Durham region area, so that I don't want to imagine what that would have been like trying to navigate either the GO train or driving down and getting access where, I was in the chair 5 days a week at a time where like that would have added up, that would have created barriers for me or impositions on my family if they were available to help. So I know that I was very lucky in a position of privilege that I was, so accessible to my treatment center, but at the same time, isolation weighed really heavy. I just got very forehead down, try to like bull through it and worry about how I felt after.
Really appreciate you, Peter. Thanks for giving us a view into your experience. I'd like to ask Kaylee about your thoughts. Can you tell us about your cancer experience?
Yes. I was diagnosed with advanced cancer as a young adult, but my cancer journey started long before that, unknowingly, when I was 15 years old. I had a mole on my forehead that my family doctor removed, and they told me that if I didn't get margins, that it could turn into melanoma, but they didn't know when or if it would. They removed it twice and they got margins, and 2 months later, when I was 16, it was back again. They sent me to a plastic surgeon, and two more surgeries later, and they again got margins. And again, 5 years later, it was back on my forehead in the same spot. After that, my family doctor decided instead of another surgery, he was going to freeze it off like a wart. And less than 2 years later, I was diagnosed with stage 4 melanoma at 22, being told alone in the hallway of the emergency department that I had cancer. My body filled with over 70 tumors. I received radiation to my eye and brain. And just yesterday, actually, I had my 27th round of immunotherapy. Being so young and being a part of the LGBTQ plus community makes navigating cancer a super intense and unique experience. And over the last 2.5 years, I've had to balance treatments, scans, side effects with advocating for myself as a young woman, where I didn't always feel comfortable speaking up for my specific needs, or even like I had a say in my own care, and also trying to find a place in the cancer world where I feel seen and represented as a lesbian. That's a little bit about my story and my cancer experience so far.
Very powerful story. Thanks for sharing, Keely. I'm just curious, would you say you'd experienced feelings of isolation along the way? Did you find you were able to access age-appropriate and inclusionary care? And were you able to access similar resources in Calgary that you might have been able to, for example, in downtown Toronto?
Yeah, cancer at a young age is incredibly isolating, and having a marginalized identity adds extra barriers. Navigating cancer without representation can make an already isolating experience feel even smaller, and it can be difficult to find spaces that reflect who you are as a human being. Being the only one at the cancer center, the only young adult, the only queer patient, it can make walking in feel even more draining because you're constantly looking for someone who might share or understand even just a part of your experience. And since I was diagnosed, I have moved 7 times across 3 provinces and received care in 4 different cancer centers in Calgary, Victoria, Toronto, and now Vancouver. And there are some amazing resources for age appropriate and inclusionary care available nationwide, like Young Adult Cancer Canada, like Peter had mentioned, and also Queering Cancer, just to name a few. They are incredible. But other programs are specific to certain locations. So finding that inclusive age appropriate care hasn't always been easy, especially in a smaller cancer center like Victoria versus the largest in Canada, like Princess Margaret in Toronto. But throughout my journey so far, I have learned how healing it is to feel like you belong in a situation that can already feel so lonely. When I started going to Princess Margaret in Toronto 6 months ago, one of my first days there, I noticed a small rainbow poster that said Queer Community, and it was a support group for queer cancer patients that met every 2 weeks. And it may sound so simple, but that poster changed everything for me. I actually felt seen, maybe for the first time in my entire cancer experience. I went and I met people who understood parts of me that no one else ever had. And they became more than just my friends, they became my chosen family. I even got to be a part of the Toronto Pride Parade with them and UHN, which was actually a dream of mine. Like, shout out to them. They were so wonderful. And they truly gave me something that I'd been missing for so long, which was belonging. And that's why age appropriate, inclusive, identity affirming care matters so much. When you're young, queer, or part of any marginalized community, you shouldn't have to fight to be taken seriously or find spaces where you fit. Cancer is already isolating enough, and our care doesn't have to be. Programs that reflect who we are beyond cancer as human beings don't just support us, they remind us that we're not doing this alone, which, in my opinion, is one of the most important things.
So beautiful, Kaylee. Really appreciate you. Thank you.
Thank you.
Harjeet, hi. Welcome. Can you tell us a brief story or summary of your cancer experience?
Uh, I'm from Calgary, originally from India, and I moved to Canada in 2018 along with my husband, having the dreams of settling down, having a family, having a career. But I had no idea that my life had different plans in this country. I was diagnosed in my early 30s with subcutaneous panniculitis T cell lymphoma with HLH in 2019, just after immigrating to Canada. And as an immigrant, we had no idea how to navigate the healthcare challenges, who's the right person to talk to. Thankfully, I had a family doctor, and I was sick for 3 months. The only symptom I ever had was fevers, high fevers ranging from 39 to 42 degrees Celsius. And initially, in the beginning, we went to see our family doctor, and she was like, take Tylenol, take home, go home, take rest. Your blood work looks fine. But there were times that, I ended up having 42 degrees Celsius at night, and my body was shivering, and I had chills. And my husband took me to emergency, and you know how emergency is. You have to wait for 6, 7 hours. And it was not one episode of emergency. I had a couple of episodes of emergency before diagnosis. And every time we ended up in emergency, there was one thing they used to tell us. You go home, take rest, you don't have any other symptoms, and your blood work looks fine. So these episodes were never stopping, and I was sick for 3 months. And I had to pre-advocate along with my husband to our family doctor. Can we do something about it? Can we, get some referral to other doctor or anything? And finally, she actually referred me to infectious disease specialist. So that time I was in Edmonton. So I moved to Edmonton initially, and I saw infectious disease specialist, and he said the same thing, same story again. There's nothing I could see in your blood work, everything looks fine. And we were asking if I could get an MRI or PET CT or CT scan, because I come from a background India where it's private healthcare system, and if you feel something is wrong, you go and get yourself test, right? So over here it was a challenge for us to get that, back in 2019. Now things have changed, so they were not listening to us, and we really had to advocate a lot. And finally, the infectious disease specialist said that, okay, I'll do a CT scan. And he did a CT scan, and something unusual happened in my CT scan. That was back in June 2019. And he was like, we need to admit you to the hospital at University of Alberta. And we see some unusual activity, but we might need to do some more scans and tests. And it will be easy for us to, get you in the hospital and do that. So I was in hospital from June 2019 until September 2019. I was treated as a research patient. I had endless biopsies, endless surgeries, endless scans. You name it, I had it. Even I was told that, we've spent so much money on your diagnosis, but we don't know what it is. And we almost gave up the hope. I was struggling physically, mentally. And as an immigrant, it was so much overwhelming for my husband to go to work, to take care of me and come to hospital. And finally, and we thought of going back to India in August. And before that, the doctors came in and they said, we just want to do one last biopsy, which is a skin punch biopsy. And the skin punch biopsy result came positive after 5 days when we were planning to go back to India. And the doctors rushed into the room, and she said, Harjeet, we got the results and we would like you to stay. Don't leave. And I was like, what is it? She's like, you got the subcutaneous panniculitis T cell lymphoma. And I was like, what is it? Because I have no idea what is it. And, telling a patient directly what it is rather than explaining, that's what I wanted. So that was the time I was diagnosed on 28th of August, 2019 with stage 4. And there are hardly any cases in Canada. There are only 150 cases reported globally. And I haven't found any single person in Canada yet with my type of cancer. And through that, the cancer was not working. So they had to do a stem cell transplant because my cancer was so rare that chemo was not working on me. And they told me after 2 months that we think that we need to do a stem cell transplant because if we keep on giving you chemo, we don't know how much time is left and your body is not reacting to chemotherapy. So I had to go through stem cell transplant during COVID in 2020. 35 days of complete isolation at Tom Baker Cancer Center because I had to travel to Calgary for my stem cell transplant without having anyone around me, not even my husband, not even my family, not single person around me. And I still get goosebumps and nightmare when I think about it, how I came so far and how, I have came 5 years out of that stem cell journey. I still celebrate that this is the second life given to me. But still, there's so much stigma and silence around cancer, because when I was going through that, there was no one who could actually understand what was going in me, right? I was thrown into fertility loss at the age of 32 without telling me or asking me what I want. I was just told that, oh, sorry, you're thrown into perimenopause because you had uh, aggressive chemo and now you're going through stem cells. So, no one actually talked to me about it. And today, I actually, share my journey through my digital platform because I was looking for someone out there with my type of cancer, but also someone who could be my own color, or who could understand what cultural barriers I faced during that journey, because I was looking for support. But there were support groups like Wellspring, YAC, CCS, and LLSC, but the only thing was missing was someone like me in that group, which made me think more like, why it's just me in the room and there's no one else. So today I work as a patient partner across research and centers in Alberta, and I also focus on health equity and system level change. I want to ensure that no one feels as alone as I did in this journey, and that diverse patient voices are included at every healthcare table.
That's great, Harjeet. I want to zone in a little bit. You touched on it for sure, but more specifically, can you share with us about any cultural stigma that you experienced throughout your experience, or any barriers specifically in the health system from a navigation perspective? You already mentioned this. I get the sense that people were not necessarily sensitive to your cultural background or practices. Can you comment on some of this?
Absolutely. I think cultural stigma was one of the biggest battles during and after my treatment. In many South Asian communities, cancer is spoken about in whispers. People fear judgment, blame, shame. Some even believe that cancer is contagious, and families may distance themselves. So when I was diagnosed, I had a family support, but there was complete silence. There was complete silence, and no one in the healthcare could understand what was going on. Even, just a small example, I belong to a Sikh culture, a Sikh community, and having hair is one of the biggest representation in our community. And when I was told that I had chemo, and the doctors tell you have to shave your head, because you can't keep your hair, but I had long hair. So, having that sense, what matters the most in our culture is to understand, and losing my hair was one of the biggest challenge, and seeing my family going through that was the toughest thing to have. So I felt I had no one to talk to at that time, and I struggled mentally, physically, socially, and financially. And there was time I actually felt burdened that I'm there, but I don't know who's the right one to talk to. And the healthcare system was there, but they didn't guided me through the resources they had. I could have been connected to a psychosocial at that time, or a social worker at that time. There was a social worker, but no one actually understand what I was going through mentally. And I feel like cancer doesn't affect you, it affects the whole family. And that's one thing which, as a healthcare worker, as a doctors, as a nurses, they should understand that we are just not patients, we are human beings too. So when I look for community support, as I mentioned, I didn't see a single person, with my background in any of the support groups. And no one actually spoke like me or shared my cultural experiences. And that isolation was really overwhelming as a young adult and an immigrant woman in this country. Inside the healthcare system, I feel that, I often had to explain myself. I often have to tell them that, okay, there are some kind of stigmas or silence around this, cancer. And still, we have big hospitals in Calgary, but I still don't see peer navigators or supporters going through with it. There are South Asian people who are coming to get their some diagnosis, but they reach out to me on my digital platform because they don't find the resources outside. So that is missing. We should have these representations in the system. We should have those peer supporters and peer navigators, people like who've suffered, through cancer and who's going through cancer in South Asian community, so that they can guide them through that challenges. And yeah, so I think that's about it. And I had to advocate for myself before, during, and after cancer. And but patients who don't have the language, confidence, or health literacy to advocate for themselves fall through these cracks. And those cracks shouldn't exist in the first place. That doesn't mean I can speak English, that everyone else can speak English.
So profoundly said. Thank you, Harjeet. Let's turn to Nadia. Nadia, could you please share with us briefly about your cancer experience?
Thank you, Dr. Dasani. The first thing I'll ask everyone who's listening to do is just think for a second about what you think I'm going to say. And then take note of anything that I do say that comes up as surprising for you. Put yourself in my shoes for a moment. I'm 30 years old. I'm sitting in a room. I go to get papers signed, and a doctor that I've never seen before, who's new at my community health clinic, sees a report in my file and chooses this time to tell me in front of my 4-year-old that cancerous cells were found under my right arm. I have no idea how to respond in this moment. So I do the most motherly thing and protect my daughter instead. And I held on to whatever emotion might have bubbled up so she wouldn't know something had just happened. I had one person to call. As a young immigrant mother in Canada, there weren't very many numbers to call. So I called my husband, and unfortunately, I can't, I'm hearing this for the first time, so he's hearing it for the first time. I did have a sit-down appointment with an oncologist scheduled for the Monday, but this particular Friday, this doctor thought that it would be a good idea to jump ahead of the game and blindside me with this information inappropriately in front of my child. I don't think you expected me to say much of that. Thankfully, I was able to start a diagnostic process that took about 2 months. At that point, they weren't able to identify that there was actually a tumor in my breast. We could feel something, but all of the tests came back saying it was normal. If it had not been for that one sentinel node under my arm that experienced disease, I would never have known that I had 3 tumors and 2 fragments. It took one doctor who fought, one doctor who would not give up, one doctor who kept pushing. I would get calls from the hospital saying, you need to come today. Your doctor said you have to get a CAT scan. You have to come in right now. Your doctor wants you to get an MRI. Had it not been for one doctor who needed to know where this thing was, imagine at 30 years old, you're hearing, oh, it's anywhere in your upper body. Oh, we have no idea. Just based on the fact that it was in this lymph node, we can't tell you exactly where it is. You're so far away from all of your friends and family. You've started to grow a small community here, and your mind is spinning. I remember driving home from work one evening, trying so hard to stay calm while my entire body was vibrating, just shaking. And it was October. So you know what that meant? Pink ribbons everywhere. And I didn't want to be a part of this club. I was so thankful that other people were raising money for other people, but I didn't want it to be me. But here I was, it was me. It was really hard because family had to take turns flying in. I'm thankful that some of my family members were able to do that. I'm thankful that my church community was able to surround me. But just imagine the layers of isolation. Motherhood is isolating. Migration is isolating. And cancer care is isolating. And so you're facing all of that. You're trying really hard to be strong for your 4 and 5-year-old, who ends up being a part of your support community, although you didn't expect her to be. My daughter, when she was 4 years old, we proactively sought mental health support for her. And we sat down with her and explained the mommy was going to be really sick from her medication, but the medication was going to help mommy get better eventually. And other people would come to play with her. My 4-year-old's response at that time was, "Mummy, don't worry about me. I'll get myself ready in the mornings." And my 4-year-old got herself up, brushed her teeth, put waffles in the toaster, put her clothes on, got her bag, and sat down at the door and waited for whichever friend from church was going to take her to school that day. The strength that we have around us comes from very surprising places. I drew strength from a 4-year-old who found her one way to contribute to Mummy while Mummy couldn't play, Mummy couldn't get down on the floor, Mummy couldn't take her to the park, but she found a way to stand right by my side when other people were closing doors, because I shouldn't be in this situation at 30 years old with no family history, trying to figure out how to live and how to survive.
Nadia, so poetic. It's like a mic drop moment. Really beautiful. Thank you. Um, I'm curious about the quality of care you received. And do you feel that the quality of care you received was dependent on your ability to navigate the system and advocate for yourself? In your experience supporting other individuals from marginalized communities, what is the perceived quality of care when an individual doesn't, for example, possess the ability or capability to be able to advocate for themselves?
Absolutely. First things first, I speak English, but that does not mean I speak medicine. A lot of us, we are native English speakers, but we are not medically literate. We are not taught growing up in school that we should understand basic chemistry terms, or that we should understand prefixes and suffixes in Latin so that we know what things are being said to us. And so, as it was mentioned before, you're sitting in a room across from someone that you trust is knowledgeable because they're wearing their white coats and their stethoscope, and you're hoping that they're going to tell you something meaningful. And at that point in time, your mind is completely swirling, right? And let's just say, like many of my friends, quien habla español, que están ahí sentados, que no entienden nada. So imagine if you just got thrown into a tailspin, understanding nothing that I said at the end of that sentence, how did my friends feel? Knowing that they're sitting across from someone who's going to deliver really difficult news to them. So thankfully, I was able to understand quite a bit of what was being said. I guess a lot of it came down to personality as well. I'm a bit of a bulldog with a bone, so you're not leaving the room until I figure out what that means. And it really made me think about the 15-minute appointment and how that institutionalizes dismissive behavior among medical practitioners. The fact that you're expected to get your patients in and out because the patient list is long and you have to get on to the next person breeds a level of coldness that I know isn't always intentional on the part of the provider, but these are extremely heavy conversations that are being had. And so if a patient is not the kind of person to show up with their binder and their pen, and as one doctor told me, put your chair in front of the door so they can't leave until they answer your questions. If you're not equipped like that with people who are telling you how to advocate for yourself and not to take the first answer as the only answer, your experience with the healthcare system is just spinning you around and around and around. It should not be my responsibility as the patient to transfer knowledge from one medical practitioner to another. These are systemic challenges that we are constantly facing that do not belong to us. I should not have to take my binder, take my printouts. I shouldn't have had to walk past the morgue to get my printouts in the first place. I shouldn't have to do any of these things because this is not my responsibility. I live in a world where I'm taking care of children, community members, family members, where my jobs put me in places where I am taking care of staff members, and I am trying to get a little bit of energy to take care of myself, and yet I have to do my doctor's jobs. Multiple specialists who write sometimes very thin notes again, not capturing the things that I think are most important that need to be shared, and hoping that the interpretation is right. If I have to do all of this and I am medically literate, what happens to the many, many, many patients who are not? Someone has to stand up and take responsibility, because it is not our job to figure out what is being said. It's our job to get better. We need to focus on ourselves and our healing journey, not on trying to figure out what everything means, because someone else won't take the time to do so. If the barrier goes beyond the medical practitioner and the challenge is that we don't have enough medical practitioners, then let's fix that. Let's look as far up the stream as we can to identify the real problems. So another 30-year-old woman, isolated from her family, taking care of her young children, don't have to work as hard as I did just to get better.
Thanks, Nadia. Let's transition to Leanne. Leanne, welcome again. Can you tell us a brief summary about your cancer experience?
Yes, hi. So as mentioned, sorry, can you still hear me?
You're
Okay.
good, yeah.
Okay, good. Yes. So my name is Leanne. Everyone else is from south of me. I'm from the Northwest Territories, not north of a province, north in a province, Northwest Territories, Yellowknife. So in 2007, my 38-year-old sister died of stage 4 pancreatic cancer. In 2012, my father died of a massive MI. So in 2015, I had to call my mom to say, I have cancer, and I was her youngest child. I was the sixth out of her 6 children. And so my story began when I was 33. I was having some GI symptoms. Again, sorry, and I'm also a nurse. I've been nursing since 2003. When I was 33, I started having some GI symptoms, couldn't really figure it out, talked to my doctor. He encouraged me to, change my diet, get more exercise than I was already getting, drink more water. I mean, I was drinking 6 liters of water a day. That was my drink of choice. I don't drink coffee. I didn't drink pop. And then he said, well, as far as your diet, why don't you go see a nutritionist? So I went to see a nutritionist, changed my diet again, and it still made no difference. And so my doctor was great. He's somebody who has treated me since I was 20. I've had reflux disease since I was 7. So, being a primary school student, every single teacher had to have Tums, Rolaids, Maalox, and this other antacid crap in their desks for me every time I asked. And by the time I became a teenager, I was so embarrassed about having to go up to the teacher to say, Miss So-and-so, I need some more Tums, because I wasn't allowed to keep it in my desk because it was medicine. And so I had reflux pretty much my entire life. So my doctor followed me diligently. We did the scopes every 2 years. If he didn't remember, I would remember, and then we would just order it and it would be done. And every scope, the longest I would have to wait is 5 days for my biopsies to come back. Everything was always normal. We always checked for Barrett's. Everything was normal. And then but with my new GI stuff, my doctor suddenly had to follow policies and protocol. He couldn't just order a gastroscopy for me anymore. He had to go through a specialist. So he had to start going through surgery. The surgeon said no. My reflex disease wasn't significant enough, even though I had been on Losec for about 15 years. I was on Pantaloc for the rest of the time. On top of all of that stuff, I was also taking ranitidine. So I was on a cocktail of proton pump inhibitors. And so my doctor tried getting me in to see the surgeon. The surgeon refused to see me. Leanne is too young. She's too young for cancer at the time. I was 33. And my doctor thought, okay, I'm going to play the game. I'm going to send you for a fit test. I did the fit test. 1 test came back positive out of 3. He sent that over. the same surgeon who denied my referral said, nope, Leanne is still too young for cancer. She probably did the test wrong. She was probably menstruating when she did the test. I'm a nurse. I'm also a woman. I know better. And no, that's not what happened, but okay, whatever. And then my doctor, unfortunately, he was going on sabbatical. And of course he said, anything, come back, somebody will see you, everyone knows you. And also, I'm a nurse, I know the system. And then finally, during his absence, I got really annoyed. I realized that one of my former colleagues, also a doctor, was now a locum in Yellowknife. And so I texted her to say, I know this is not the way to do this, but can you see me? Can you figure out a way to send me for a scope? Because this is getting ridiculous. So I went to see her. She took my whole history. She said, I'm going to play ignorant here and say that I didn't know that I was supposed to follow policy. I'm going to send your referral direct to internal medicine. They got my referral 2 days later. They happened to have a cancellation with their internist. They fit me in. And based on my symptoms, my physical assessment, he said, you're going to have a colonoscopy this Friday. It happened to be my 34th birthday that day. So I went, and then unbeknownst to me, when I was the nurses, I guess, were asking the internist, the gastroenterologist about, why did we fit Leanne here today? And he said, we take care of our own. And honestly, being a nurse saved my life. So he did the bioscope, did the biopsies. He said, I found 3 polyps, not usual for your age. I'm going to send you for a gastroscopy. There is a longer wait list for this, but it'll get done in the next couple months. So colonoscopy was done. And then I just had to wait. And that was in February 2015. July 2015, I got a phone call to say, we had a cancellation tomorrow. Can you come in for a scope? There's no prep. You just have to fast from midnight on. I said, sure. Called work to say, going in for a last minute scope. I'm not going to be in the clinic today. I went in, and just that morning, I just had this horrible feeling in the pit of my stomach. I knew there was something wrong. And so my husband came in with me. And then even he said that there was something weird about the procedure, because he'd been through these a few times with me. He said they were really fast. He said, usually it means, in my opinion, I mean, he's not in medicine at all. He just said, I thought it meant that, there was nothing to see. And so it was done. And so you came out, you slept, and then you woke up, the surgeon came, and this was a visiting surgeon, not the original one who refused to see me, a different one. And she just said the words that just made me feel physically sick. She just said, there was some redness in the lining of your stomach. I don't think it's anything sinister, but I took a sample anyway. And that was the last I heard about it. My 5 days went by, then 10 days, then 15 days. And even my husband said, isn't it weird that no one's called you back yet? I said, it is. I'm going to make a note to call them tomorrow, because we were actually physically in Edmonton. We were shopping because we were in the process of building our house. And so that was a Friday. And then I get a phone call, and it was the gastroenterologist who I saw in February, to say, Leanne, I need you to come into the clinic. I said, John, I can't come in. I'm not in Yellowknife. I'm in Edmonton. He said, oh, thank God. And then I said, what is going on? Because it was 8:15 in the morning. And he said, are you alone? And I said, no, Kyle is with me. And he said, okay, can you get him, please? And I said, no, I need you to talk to me. What's going on? And he said, I need you to sit down, Leanne, put me on speaker. So I put him on speaker. I called my husband in, and he just said, you have cancer, my girl. He said, I'm so sorry to tell you this over the phone. He said, we just got your lab result back. And the reason why it took so long for my result to come back is because no one wanted to call me, because everyone was a locum up until my referring gastroenterologist came back to work. And then there was also talk about my particular sample at a roundtable discussion here in Edmonton, with all the surgeons, oncologists, everybody, what have you. And because everyone thought that my sample was a mistake. They thought that my sample got mixed up with someone else's because, Leanne is only 34. This is not possible. She has no symptoms except for that one pesky thing called constipation that has nothing to do with her stomach. And so they debated sending my sample for DNA testing. And then through the process of elimination, they realized that I was the only sample that got taken that day. So they figured it was correct. So everything happened really fast after that. So go from sitting in a hotel room at 8:15 to getting ready. And then my gastroenterologist said, I have a colleague. He already knows all about you. This is his office number. They're waiting for you to come. Please go there as soon as you can. So we went. He looked over everything. He just said, you have cancer. We don't know what stage. We need to do more tests. So my 48-hour trip into Edmonton became 7 nights. And thankfully, I work for the government and I had really great medical benefits. And so one of the things that I like to think about is, what if this was somebody who was not, financially, set back by something like this, where they had to stay in a hotel for 7 days, rent a car because we flew here. And my husband needed, to eat meals while I was sitting in the hospital. And so we incurred all the cost, figured we'd deal with it later. And then a week in the hospital, I had 2 more gastroscopies. I had 54 biopsies of my stomach taken, and only 2 of which came back positive for cancer. So then came the conversation of what kind of surgery are we going to have? My surgeon said the most successful procedure that he could recommend is total removal of my stomach, part of my intestine, part of my esophagus, and all my central lymph nodes. And we're going to do the surgery in 2 weeks. So I went from having no cancer to having cancer to having my entire stomach removed over the course of 2 weeks. And then again, remember, I'm from the Northwest Territories, not from a southern urban center where you have specialists, down the street. So a trip from Yellowknife to Edmonton is a 15-hour drive. It's a 2-hour flight. So just think about all the people in the north, and then and all the rural communities and provinces who have to travel to big centers. Then back to what one of the other participants said just about the language. So I speak my first language. English is not my first language. I speak Quechua, which is a Dene language. And so a lot of people in the high Arctic still speak their first language, which isn't English. And so they require medical interpretation. And then so again, back to falling through the cracks, this happens all the time because you don't have medically trained interpreters. You have family members who are acting as interpreters when they really should be there to support you. And I know I'm running out of time.
Sorry. Yeah, Leanne, we just have to wrap it up. That's so
Great.
sorry. Thanks so much, Leanne. Really appreciate the story, and with such detail. We really felt like we were there with you every step of the journey. I want to take a moment to really honor what we've just heard on this incredible panel. To our panelists, your honesty, your clarity, your willingness to share such personal experiences is truly a gift. You helped us understand something that data alone cannot capture. You showed us what it feels like to move through cancer care while navigating stigma, clearly cultural barriers as well. We heard about age-related gaps, identity-based discrimination, geographic inequities, and the emotional weight of having the onus on you, right, to advocate for yourselves when you're already exhausted and dealing with cancer. You reminded us that cancer is not just a biological diagnosis. It's shaped by systems, structures, policies, and the environments that either support people or make their journey harder. To our audience, we hope you felt both challenged and inspired to carry these lessons back into your organizations, your clinical practice, your research, and your leadership. And with that, we will end today's conversation. Thank you so much for joining us. Yay to our panelists.
Thank you so much, Dr. Dosani. That was just a wonderful session. My goodness, it was emotional and raw and very just real. And I'm so grateful to each and every one of you for sharing your perspectives and putting yourselves out there and being vulnerable. And we're seeing lots of thanks coming through in the audience comments for sharing your experiences. So audience, we will be right back with our next session. Stay tuned and we'll see you very shortly.